Kosuanati era one radio empenyini say yensoma na motenten yesoma banyasafo era one radio Kosuanati era one radio empenyini say yensoma na motenten yesoma banyasafo era one radio yedin sem anumuaye ebrem.
Hello, good evening, Era One Radio listeners. Those of you watching us live on Facebook or YouTube, I wish to welcome you to our tonight's broadcast. Tonight we're doing the Health is Wealth show, Protect It. I think we haven't been online for a couple of weeks because of, technical glitches and, time factor. But then tonight we are live and I am bringing you a very interesting topic tonight. For those of you who have subscribed to our radio station, please, you can call in 240-280-2633 or you can text 510-931-0946 and join our live broadcast. Tonight happens to be very interesting. Normally, as you know, I begin with some current news or current events. So I want to begin by saying the Afghanistan pullout. The service members they're trying to pull out of Afghanistan is kind of, going a certain direction. Already we've lost 13 members. And in retaliation of that, the US also, dropped a drone that eliminated two ISIS-K, and one was injured. We're also hearing about Hurricane Ida, which is coming down towards New Orleans. And then we have COVID-19, the Delta variant, also taking away lives. We hear of some young persons in some parts of Africa killing fellow human beings and stacking them in refrigerators. If you ask me what is the purpose, I wouldn't be able to tell you. These are events that are going around the world, and some of them you don't have control over. But the topic we're going to discuss tonight is one thing that you can have control over. It's called the chronic kidney disease. Despite events going around the world, we don't have control over. But these things we have to take care of our health. That's why we say health is wealth on Era One Radio. Your health is your wealth. Protect it. Because the money that you're going to use to, go buy medications, hospitalization, all that if you save is going to make you rich. So we come with a slogan, health is well protected. All right, tonight, I'm so excited, very, very excited because of the guest who is here tonight. I have known this man for several years. And he used to be, of course he is, well, we used to be in the Navy together. I met him in the latter parts of 1990s. I think he went to core school before me in the Navy, and I went to meet him. He was the valedictorian of his class. There used to be what they call the African connection because he, another friend, Dan Kwa and Apia, these African guys were zooming the class. I mean, they count 1, 2, 3, 1, 2, 3 in that order. So they call them the African connection. They were so smart. The white guys were scared of them. And then I joined him again in lab school. I thought that was enough. There too, this guy wasn't studying that much, but he was still beating everybody in the class and he still became the valedictorian. When we finished lab school, normally when you come top of the class, they give you the option to choose which station you want to be. Actually, before that, let me go back. Before the lab school, he was top of our class and he chose Jacksonville as his duty station because he smoked everybody. And so I met him lab school too in Virginia, Hampton. He was there again. This guy with a big head, big brains, smoked all of us out again. So this is a smart guy. And I knew he wasn't going to waste his brain. So he chose a career that required using much of his brain. I'm not saying the other professions are not something you use your brain, but this guy decided to challenge him. He wanted to do something that would challenge him. So he became a medical doctor. All right, so I'm talking about Dr. Charles IBIE. We all go by the first name Charles, but I used to tease him that I am the original Charles and he is a fake one. But because he's smarter than I am, I just have to relinquish and give him the original Charles. He completed his enlistment and studied medicine at the Florida State University. That's the College of Medicine. He did his internal medicine residency at the University of South Alabama in Mobile. And then nephrology at Tulane University. He practiced nephrology at Dothan Hypertension and Nephrology Associates in Dothan, Alabama. And by the power of technology, well, you can Google any health issue, any health problem, but it's not the same as somebody who is a practicing doctor who works in that department. He knows both the theory and the practicals. I mean, some of us, we did our PhD in public health. We know just the theory, but this guy knows the theory and he's even he's a practicing doctor. So he knows the whole 9 years about kidney problems. So that is the man I'm going to discuss tonight's program with. Of course, we are looking at the CKD, chronic kidney disease. And if you just join us, please call in 240-280-2633 or text 510-931-0946. And I want to thank Dr. Ostis for manning the instruments tonight. And he's been playing music and keeping us busy dancing. So I'm taking it from here to give him an hour's break. So join us. Let's enjoy this lively discussion. All right. So before I continue, I want to give Dr. IBIE the opportunity to say some greeting, shout out to his family, whoever he wants to give some, shout out to before we continue. Doctor, you are welcome.
Yeah, hello everyone. I just wanted to say hello. I'm glad to be here with you guys today, and
Shout out to before we continue.
I'll try to do my best to answer whatever questions come along with chronic kidney disease, and we'll just see how things go from there. All right.
All right, thank you, Dr. Charles. I try to pronounce your middle name, but my mouth might slip. So maybe along the way, maybe you give us that your romantic big name. All right. All right. So tonight, like I said earlier on, we are doing CKD, chronic kidney disease. And one may ask, being a epidemiologist, let me just start by saying that kidney disease, he will go into the interior, the details, but let me just say, when you say kidney disease is what? Just kidneys that are damaged and cannot filter your system very well. That's the basic definition. But then he will go beyond. And when English people or the dictionary prefixes a word with chronic, then of course, it's gone beyond the ordinary. It's more, involved than we can think of. It's gotten to a stage where it needs major attention. So I'm going to ask Dr. IBIE all that. But before that, let me give you some stats. I don't know whether he's going to touch that, but I would say from CDC, according to CDC, more than 1 in 7, that is 15% of US adults or 37 million people are estimated to have CKD. That's a chronic kidney disease. As many as 9 in 10 with CKD do not know they have it. And about 2 in 5 adults with severe CKD do not know they have CKD. So that is serious. So I'm going to let Dr. IBIE explain to our doc. When we say chronic kidney disease, what actually do we mean? What is that?
So chronic kidney disease is when your kidney is not doing what it should be doing like it was doing when you were born. First of all, you've made a note of it, like saying the kidney does filter the blood. So the kidney does 2 things, actually. It filters the blood and it helps us get rid of the fluid. All right. So the getting rid of excess fluid part, we all know that. We go to the bathroom, you use the bathroom, pee. We know that is doing that job. The other job is also the filtration of the blood. Filtering of the blood is something that we can never really know. The only way to know that is by knowing that, hey, you know what? You draw your blood from your doctor, and from that doctor's lab, they can tell what stage your kidney is. And that's what we need. Most people don't really know, like you said, most people don't know that they have kidney disease, because by the time you start knowing that your kidney is not working so well, it's already getting close to dialysis at that time. Mm-hmm. So the best thing is to know before then, so you can try to prevent the effect of your kidney getting worse before you actually get to the point where you have to rely on the machine to help you with that.
Awesome. Thank you very much, Dr. Charles. That is a very, detailed definition and explanation of what chronic disease is. All right. Thank you for those of you watching us. Again, it's the Era One Radio. You can catch us live on Era One Ghana Modern Radio or Facebook, YouTube. If you don't have the app, please go to your Play Store or Google app, download the app, and anytime Era One is up live, you will catch us or you'll be notified. I want you to join us tonight. Please call in 240-280-2633 or text your question, your suggestions to 510-931-0946. And I must say that Dr. IBIE is a Nigerian-born smart guy, a U.S. citizen, learned, smart, what have you. So it's an honor. This guy is very busy. He's very, very busy, but I was lucky to get him to spend an hour with us. So please join us and let's enjoy this fruitful discussion. All right. So he just explained what chronic kidney disease is. And so, Doc, my next question is, if somebody, still alive, doesn't know what kidney disease is, how did they know that they have it? What could be some of the symptoms? If somebody says, okay, I feel I'm getting this, but I'm not sure, how does a person know that he or she has this kidney disease, the chronic part of it?
So the thing is, the sad thing about it is you never really know. Again, the time you know is by the symptoms getting so bad. So the other way you could find out that you have chronic kidney disease, we all go to our doctors every time they draw blood. You need to know what to look for in your lab to know what stage your kidney disease is, and if you have it at all. So I'm going to give an example here. So does anybody see this? Can you see this?
Yeah, I see your tables and stuff. Yeah.
Yeah, see this table right here. Let me go this way right here. Okay. See these numbers here?
Oh yeah, okay.
So this is whenever you get a lab drawn, right? You see this creatinine here. You see where where they said creatinine?
Okay, I'm looking. Yeah.
Okay. And you see where they said EGFR?
Okay.
The EGFR said African American, and they said EGFR non-African American.
Okay.
But they didn't spell the whole thing out, but you get the point.
Okay.
Okay. So whenever you get like lab drawn, the thing you should be focusing on, depending on your race, you could do the African American or non-African American. And these numbers is what I'm going to explain to you today. The creatinine is good to look at that, but that's not what is going to tell you what stage of kidney disease you have. What's going to tell you the stage of kidney disease you have is this EGFR stuff. What does EGFR really mean? EGFR is basically the estimated glomerular filtration rate. Okay. You really don't need to worry about the jargons for the medical part. All you need to know is EGFR is basically telling you how much your kidney filters. We know, just like we said before, the kidney does two things. It helps us pee, and it helps clean the blood. So the EGFR is telling you the cleaning part of the kidneys. So that number there, what you should be looking for, the different stages. When that number is greater than 90, when the EGFR is greater than 90, it can be as high as 120, 140. That number shows that your kidney is working just fine. That's a normal kidney function. Okay.
Wow.
However, whenever that number is between 89 to 60, we say you have mild chronic kidney disease. Whenever that number is between 59 to 30, we say you have stage 3 kidney disease. And stage 4, which is severe, is 29 to 15. And less than 15 is when we start talking about dialysis. Basically, the reason I'm bringing this up is there are a lot of people that I've seen in my office who came to the office and said, hey, you know what? No one ever told me I have kidney disease. I don't feel bad. I feel great. So why are you telling me now that I have kidney disease? The thing is, most physicians, when they draw your blood, as long as you don't have any symptoms and as long as your numbers still look like it's okay, they don't tell you anything. The time they start worrying is when they see that the number is starting to go to either 40 something or less. Because by the time you get to 44 or less of that EGFR I just showed you, then we start saying you are chronic kidney stage 3B. Those are the worst part now. However, whenever your number is less than 60, you're already on the moderate part anyway, stage 3. So the only way you know that you have chronic kidney disease, to answer that question, is by looking at your lab result. But the only way to look at the lab result is to know what you're looking for. So whenever you draw blood and you look at they give you all these results here. So again, you look and say, okay, what is my, can you see this?
Yeah, I see. Yeah.
What is my EGFR? What is my EGFR? And depending on what race I am, what number do I fall in? If that number is saying that it is less than 90, you already know you have some kind of chronic kidney disease. You know, if it is like less than 60, you already know you're in the moderate side.
Wow.
You know, but if it's less than 30, you know for sure you should have been seeing the kidney doctor a long time ago.
Let me interject real quick. So does it mean any blood draw you draw at the lab, is this test part of it? Is it automatically tested?
So whenever you go for your yearly visit,
Okay.
they usually will have what they call the people have. It depends on what kind of lab the doctor is getting. They could be getting complete chemistry panel, which
Okay.
you know about that you were in the lab.
Yeah.
So, or they could be doing a basic metabolic panel or renal function panel. All those things have creatinine and
Okay.
GFR in it. Depending on where you get it, though, there's some location. If you're like in a very small city, they could do the creatinine and not do the GFR because they didn't calculate it. So in that case, you probably might want to ask your doctor, or just say, what is your GFR? What is the
Mm.
GFR is what you really need to know. Because if you know the GFR, you will know if you have chronic kidney disease or not. Because sometimes the GFR can be worse acutely.
Okay.
When you have an acute kidney injury, let's say you were sick, you were having nausea, vomiting, diarrhea, those kind of things, it can acutely cause the kidney function to get worse. That number could be worse one time. One time is not all you depend on. You
Mm.
have to repeat that lab again and see, is it getting worse? Is it better? Or is it about the same? If it's getting worse, then you need to be worried. If it's better, you know, okay, well, maybe it's just something that came on and it's going to go away. But if it's about the same, you need to know, okay, well, this might really be the stage of kidney disease I am in. So you don't start. There are some things where we'll talk about that down the road, what to avoid, what not to avoid. So
Okay.
that way you don't keep doing these things to yourself and making the things worse because you didn't even know in the first place that you have chronic kidney disease.
Wow. So, which means after this discussion, every listener should be able to look at their GFR results. Because anytime you see a lab results, I mean, sometimes I look at my lab results, even as a medtech, I look at my, the basic, metabolic panel, I look at those electrolytes and the stuff that pertain or I think is. But now you have to be more detailed and look at GFR with the E in front to see whether you are prone. That is awesome. Right. You mentioned something like acute. I don't know whether there are different types of kidney disease. I mean, we're not going to go into detail, but just by mention, what are the various types of kidney disease that are available? You mentioned acute as one of them. Are there any that we should be worried about?
So the main thing you should be worried about, of course, we have the acute kidney injury, right?
Okay.
Acute kidney injury can happen to anybody, really. Can happen to, it doesn't matter your age or whatever. But the main thing here is with acute kidney injury, what usually causes it? It could be because someone's blood pressure dropped too low,
Okay.
someone's blood pressure was too high, someone was vomiting, someone was having diarrhea, someone had took some medicine that could cause their kidney function to get worse acutely. There's a lot of things that can cause you to have acute kidney injury. There are other different kidney conditions, though, but those ones are not the ones we're focusing on right now. One of the things that you will need to worry about, anybody would need to worry about, is whenever you're thinking about the kidney function, if you did see that your kidney function is getting worse, you would definitely need to check your urine to see if you're having protein in your urine.
Okay.
Because having protein in the urine can also cause the kidney function to get worse even
Okay.
more. So the acute kidney injury is usually for something that's going on acutely with you, urinary tract infection, any kind of infection, nausea, vomiting, diarrhea, medications that you might have taken, high,
Okay.
low blood pressure, those kind of things. But those things, as long as the thing that caused it can be corrected, acute kidney injury most times can be resolved. However, there are people who will have acute kidney injury and end up on dialysis, but that's a whole different story. So let's focus on this.
Okay, all right. Thank you very much. Yeah, I'll be coming to what to avoid, but I want you to go back a little bit and touch on some of the causes. In case somebody just joined us, would you please go over what are some of the few causes of CKD? What causes them?
Okay, CKD, the things that cause CKD, the number one cause of people going from a normal kidney function greater than 90 GFR
Okay,
to dialysis in a few years is diabetes.
diabetes. Okay,
So
wow.
if someone have diabetes and they refuse to control it with time, that is sometimes it could be 10 years, sometimes it can be 20 years, but unfortunately, sometimes it can be between 3 to 5 years. Someone can go drastically to dialysis. So that's one of the things. The other one would be the medicine you take. So
Okay.
whenever you check your kidney function, let's say you see that you have like some kind of chronic kidney disease because of the numbers that we just discussed briefly,
Okay.
what you should be focused on then is avoiding things like ibuprofen,
Mm.
goody powder, Aleve, Celebrex, all those things, anything called non-steroidal anti-inflammatory drugs. It does help with inflammation, of course, but it can destroy your kidneys. So
Mm.
those are the things you should avoid. You should cut down on your red meat intake.
Mm.
Red meat. Red meat meaning steak, hamburger, deer meat, and any kind of things that they consider red meat. Pork is not red meat, by the way. Chicken is not red meat. So those are not the ones I'm talking about. I'm talking about red meat, like I just said. And the other thing that you need to watch out for or cut down is salt. You have to do low salt diet. But I have a lot of patients coming to me all the time in the office and say, hey, you know what? Yeah, you said I shouldn't do salt. So I'm not really doing salt. I'm just doing Himalayan salt. It can be African salt,
Salt
Himalayan
is
salt.
salt
The
is salt.
salt is salt. So you got to cut down your salt intake. It doesn't matter what kind of salt we're talking about. Salt is salt. So that's one thing you got to. Those are the things that we usually focus on initially. But as the kidney function get worse, though, they are the things that the kidneys won't be doing anymore. Like your
Mm.
potassium levels start going up, the acid levels start going up. Then we start adjusting more food. We start telling you stay away from this or stay away from that. But we cannot tell you to stay away from everything initially. The major things we tell you to stay away from at the beginning is no ibuprofen, goody powder, or all those kind of medicine. Limit your red meat intake and low salt diet. And also, if you're having chronic kidney disease, one thing you should do is make sure before any doctor starts you on any medicine, you got to let them know you have chronic kidney disease so they can adjust your medicine according to what your stage of kidney disease is. And you cannot say, oh, the doctor will know. Trust me, they won't.
Mm.
I have had a lot of cases where someone will be on a very high dose of medicine that's not fit for their kidney stage. Just because you got to realize most doctors, either they're like in a hurry or one thing or the other. But at the end of the day, you are the one that's going to end up on dialysis, not them.
That's
So
true.
you got to focus on your stuff and you got to remind them, but you can only remind someone if you know what you know, right?
Mm.
So you got to know what is concerning your kidneys and you got to know what to focus on. Like tell them, for example, hey, you're about to start this medicine. Is that good for the stage of my kidneys? And you got to know those numbers too. Because let's say they don't know, for example, you know your number is 44 on your GFR. You can just say my GFR last time I checked it was 44. You might want to
Mm.
look at my medicine to
Mm-hmm.
adjust the medicine to that stage. So all these little things that we're talking about can cause the kidney function to get worse over time. One of the major things that cause the kidney function to get worse though is the protein in the urine. So
Protein.
someone have
Mm.
diabetes, they have diabetes or they have any other condition. That's why that needs to be checked periodically. If you have protein in the urine and you're spilling a lot of protein, there are medicines that can be used. You can cut down on your protein intake. There's a lot of things you can do to try to slow that down. However, if you don't know and it gets worse, then that also can cause the kidney function to get worse.
Wow, man, that is knowledge from a medical doctor, somebody who is spent years studying in medical. So that is awesome, Doc. Thank you very much. Well, let me say here that we have only one body. God gave us only one body. When that body is wasted, that's it. You're done. I don't care whether you believe in evolution, that you're going to come back, or I don't know, but you have only one body. And some even say that, oh, if my kidney is messed up, I can get a transplant. We'll come to that later. But taking prevention always is better. I mean, sometimes it's difficult. He mentioned red meat. I'm still trying to get over red meat. Every now and then I sneak in the steak. It tastes good, trust me. I mean, it's
They're very
nice. I
good.
mean, it's good when you are enjoying, you go out for birthday treats and you are enjoying that steak, you know. It's so easy to say, hey, can I get some steak? But then behind it, at the end of it, what are you doing to your body? Sometimes we are poisoning our own bodies, but we don't even realize. All right, Doc, we all know of this adage, too much of everything is bad. I don't know whether it can be applied to water. If you drink a lot of water, is that bad for your body or your kidneys?
So this is said a lot. Like most doctors tell their patients, Drink, 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 drink. If you drink a lot of water, you'll make your kidneys better. Actually, I think it's just something that came over age and people just kind of keep saying the same story over and over again. However, a study was done recently that showed that no matter how much water you drink, it really doesn't make your kidney better. If anything, the study that they did, it made it slightly worse, but the confidence level of that was not too much. So,
Okay.
but basically, it didn't make it better.
You mean
However,
water didn't make kidneys better?
drinking too much water.
Too much water.
What you should do is drink water when you're thirsty. If you're out in the sun, you're sweating, you drink more water. But not intentionally keeping gallons and gallons of water at home and just sucking it down, thinking that will make your kidneys better. No, it doesn't.
Wow.
However, if you have kidney stones, you can drink more water because that would help prevent the kidney stones from forming. If you have a condition that we call polycystic kidney disease,
Okay.
and you need to drink more water because that will help it slow down the progression. However, if you have chronic kidney disease, drinking a lot of water is not a solution to making it better.
Wow.
Your lifestyle and how you control your diabetes, your blood pressure, and avoiding all this medicine I said, those can make your kidney function slow down, and maybe it can even be better sometimes.
Wow, you are spilling out a lot of info today. I mean, some of the things that we used to believe in. Now I don't know whether I should go back and rethink them. That is knowledge. Anyway, I'm going to go to this question on transplant. We'll come back. Before I do, let me take a quick message because I know you also want to take a sip of water for talking almost 28 minutes, and then we'll continue.
Kosuwa na ti era one radio empenyini say yensoma na motenten yesoma banyasafo era one radio yedin nsem anumuaye ebrem.
Okay. In case you just joined us, you are still listening to One Radio live on Facebook and YouTube. If you don't have the app, as I said earlier on, please download the app from your Google Store, Play Store. Anytime Era One is broadcasting, you will be there. And please invite a friend to watch. Era One is the, to my knowledge, the best radio station in town because we do all kinds of, broadcasts. We do health, we do marriage. I mean, everything under the sun we discuss. And these are all to what? Inform our people, entertain, and educate. Well, before the quick message or ad, we're talking about drinking water, and whether it was necessary to take excess, and Dr. IBIE nicely explained. All right, now let's go to transplant. Lucky enough, it looks as if nature, let me say, God was so kind to us by sometimes he gives us a second chance. Sometimes we have second chances in life. You can get rid of something and you mess it up, but God gives you a second chance. There are some few things that I don't know whether they are second chances, but most of them we do. So we talk about kidney. God gave us two. I love God. He gave us two of almost all the things we need. Two kidneys, two lobes of lungs, two eyes, but then only one mouth to slow down how we talk. All right, so you mess up your kidney and you need transplant. At what point in your life do you realize that you might be leaning towards a transplant? When do we get to that stage?
So if we have someone who has chronic kidney disease, again using the GFR I was talking to you about, the filtration rate of the kidney. If that number there is consistently, every time you check the blood, less than 20, then the person can be referred for transplant. The question I get asked all the time is, do I need to get on dialysis first before I can get transplant? No, not necessarily. If you have your GFR less than 20, we refer you for transplant. If you get if you get something available that matches you before you even get to dialysis, they'll give it to you. However, if you don't and you get to the stage of dialysis, you'll be on dialysis, at least you are already on the list. The sooner you get on the list, the better for you. Because whenever it's consistently less than 20 and you get on the list, you might not get on dialysis for another 3, 4, 5 years or even longer sometimes. So if you're on the list and they start walking you up and getting people ready, maybe they get a transplant kidney, a kidney that fits that fits you, that matches you perfectly, and they can give that to you. And also the kidney transplant, you said something about 2 kidneys. That's true. We all have 2 kidneys, but all we really need is 1 kidney. We don't need 2.
So the other one is a spare one.
Exactly right. You only need 1. You're giving to, I guess, God, like you said, God gave us 2 kidneys so we can be good Samaritans and give 1 to another person. So no, seriously, you only need 1. But also, whenever you have the kidney, when we have talking about this chronic kidney disease, one question I get asked almost all the time: are both my kidneys getting worse, or is it just one?
Okay.
The answer is both. So when your kidney function is, let's say the GFR I just talked about was less than 20, that less than 20 apply to both kidney. There's no one kidney on reserve and the other one is still acting. No, they both work equally and they both go down equally.
Wow. Yeah, when you mentioned the fact that we need only 1, it reminds me about a very good friend of mine who had to get a kidney transplant, and guess where it came from? I think we were discussing that, and his nephew had to try, but then they were not compatible. But guess who was compatible for him? His wife. So his wife donated a kidney, and I mean, if you have my kidney, you will treat me well, and if I know I have your kidney, I'll treat you well. So these couple are so much in love, and it's amazing how this giving kidney is really functioning. So I mean, God is wise, and all we need is 1. I mean, give us a spare one just in case something happens. That is awesome. And then you mentioned the word dialysis. Dialysis could be a good word or it could be a frightening word. I don't know whether our listeners have a question on that, but I want you to expand and give us some tutorial on what is dialysis, what does it entail, and what goes into it.
So before I go to dialysis, let me clarify something about a transplant.
Okay.
So let's say you have that person, the cousin, who needed to give the kidney, right?
Okay.
And the kidney is not compatible. There are other options. It's good to have someone who will give you kidney than to not have anybody. Because if you have someone that's willing to give you their kidney, the transplant center can then take that person and match it with another family member who's willing to give their kidney too.
Okay.
And they just keep matching like that until they get someone who they match and they give that kidney to that person. The same thing, they'll do the same matching for you. And when they get someone that matches you, it's not your family member, but it's someone that matches you. They will give theirs to you and they give your family members on to theirs. So if you have someone who's willing to give you kidney, you not matching them don't necessarily mean that they still cannot help you. They can still help you. By them being available, you have a higher chance of getting a transplanted kidney quicker than not having someone who's willing to give it to you. So I just wanted to clarify that.
Thank you.
So now going to dialysis. What is dialysis? So like we said, the kidney does 2 things. It helps us filter our blood and it helps us get rid of excess fluid. Like when someone have too much, if we can't pee, then you get too much fluid on, you get swollen and stuff like that. So if you cannot do that anymore, that's what dialysis does. If you cannot do one or the other. If you can't pee, because most dialysis patients, after it gets to a point, they can't pee anymore at all. They don't pee, 0 at all, every day. So that means we have to tell them to restrict how much they drink, because what the dialysis machine does, the dialysis machine helps them get rid of the fluid, which is what the kidney was doing before.
Okay.
And also the dialysis machine helps them clean their blood, which is what the kidney was doing before. So the dialysis machine is basically just an artificial kidney.
Oh, okay.
That's all it is. It's just an artificial kidney that does what the kidney was doing before, except we have to adjust some things in the machine to suit the patient that we're taking care of.
And you can't take the machine to your house. It has to be a center.
So not necessarily. There are two kinds. There are
Okay.
actually three kinds of dialysis. There's the one that you go to the center, right?
Okay.
You go to the center 3 times a week, either Monday, Wednesday, Friday, or Tuesday, Thursday, Friday, Saturday, or twice a week, depending on how good your clinic is. So those are the in-center one. They have another dialysis that you can have the same dialysis that you do in center, you bring it home. We don't do that here where we are, but there are some places where they can do the home dialysis. You still use the blood, the same blood, you hook it up yourself and everything.
Mm.
However, there's another third one that's called peritoneal dialysis. This one has nothing to do with blood. They put the tube in the stomach area, in the like the lower stomach area, they put the tube in there. You
Okay.
put like a very concentrated sugar water in the stomach area, and that water will clean the blood, and after a few hours, you empty the whole thing out and then fill it back up again. But most times after the training, some people do it manually by themselves. Here in America, they have machines that can do it for you. You just lay down at night, hook it up, the machine will empty and fill it back itself while you're sleeping.
Mm.
So that's what we call peritoneal dialysis.
Wow.
So you can do that all night without even knowing. And during the day, if you're still not cleaning well, then you can try to put some in and empty it by yourself through the day. With the good thing about the peritoneal dialysis is when someone is doing peritoneal dialysis, they can basically function like they were before without interrupting what they do. They can still go to work during break time. If they do the manual one, they can go empty and refill it again, just like going to the bathroom to do things, you know? So, except of course, you got to wait for the whole thing to fill up. But regardless, you can still do the things you love to do. And if you're doing the peritoneal dialysis, you can travel with the machine. It's
Mm.
very portable. And most people just don't like doing that though, because they think it's too much work. However, that's is very easy to do as long as you have a house to stay and you have a very a clean
Mm.
environment. Just clean. It doesn't have to be sparkling clean, just clean enough. And you should be able to do that.
Awesome, awesome, awesome. Thank you for coming on the health is worth protect issue. Thank you very much, Dr. Charles. I really appreciate it. On the around, we like to educate our people because some of the myths that we lived with all our lives, we want to debunk them and make sure our listeners are getting the best knowledge. I think I must have asked this question already, but then if let's say somebody is up for dialysis, how do they even start preparing for the dialysis? Is there any, I mean, you being in the practice, how do people actually start preparing for dialysis?
So that's one thing I always tell patients is it would be better for you to know you have chronic kidney disease
Okay.
and you know that it's getting worse so you can be prepared of what's coming than for you to come to the office one day and we say, wow, your kidney is so bad. You need to start dialysis tomorrow. That is a shock. No matter how strong a person you are, if you came to the doctor's office the first time, they're trying to do a drastic treatment like that, it is very tough to deal with. So this is how it works. You have a kidney disease, you check your GFR. Your GFR is like maybe 40 something, let's
Okay.
say, right? You tell your doctor, hey, my GFR is 40 something. You probably might need to send me to a kidney doctor, right? Your doctor actually listen to you, I hope, and then send you to a kidney doctor,
He
right?
better or she better.
Yeah, it sends you to a kidney doctor, and then when you get to a kidney doctor, they look at it that your kidney function is staying stable, and they just be watching it yearly, or 6 months, or every 3 months, depending on how bad it is. And as they get, of course, they try to correct things medically as much as we can. We try to correct things. However, if you start progressing to the stage of dialysis, then we start educating the patient on what dialysis is, on what you need to do dialysis. Then we start telling them about the different kinds of dialysis. Then we start telling them about transplants. We tell
Okay.
them about all these things, preparing their mind for these things. That they don't have to be at that stage to tell them. When they get into that stage, close to the stage, you start giving them that information. And then whenever it gets closer and closer to the stage, then the way we do the dialysis, by now you would have sent the person to what we call kidney education.
Mm-hmm.
In the kidney education, they'll tell them about the different kinds of dialysis. And then the patient will have to make a decision which one they want. because depending on the kind of dialysis they want, that determine the kind of access we give. If someone said they want peritoneal dialysis, that means we're going to be talking about an access that goes in the stomach area, right?
Okay.
The lower abdominal area. So if let's say that one we're doing that, that one does not require 6 weeks, 8 weeks, 10 weeks to be ready. Once they put that thing in, after 2 weeks it heals, you can start the dialysis.
Okay.
They start the training first, and after they train them, then they let them do it at home. That's the peritoneal dialysis. The one that the in-center dialysis or the other dialysis that you can do at home that still involve blood, that one you have to, this one we call the hemodialysis, okay? That's hemo meaning blood, hemodialysis, okay? So the other one is peritoneal dialysis because it's in the peritoneum area, all right? So this one that's hemodialysis that require blood, they have to put let me see my hand here. See the hand here? They have to take the vessel, the vein and the artery, connect them together, right? Connect the artery to the vein and let it mature.
Artery to the vein.
So they tell the patient to be pumping their hand to help the arteries and the vein mature. So that one takes longer to get ready. The average time that one uses to get ready is 6 weeks. But 6 weeks is the average. However, if you have someone whose arteries and veins are very tiny and cannot get matured, then they might need to do the procedure again.
Wow.
They start from the lower arm and go up, right? They try the lower arm first, it doesn't work. They go up higher and higher, right? So this process can take 6 months sometimes before the surgeon will say, you know what, none will work for you, we'll have to do a graft. So they do an artificial artery and an artificial vein for that person. You see what I'm saying? So depending on what you're going to get, depending on the kind of dialysis the person is going to get, they have to decide quick so we can decide if we need to send now or wait a little bit longer. Because for the peritoneal dialysis, most times we don't send them to the surgeon for the access placement. We call them access, okay? Because that's how you access the part that you're going to use them to treat them. We don't send them to the surgeon until close to the time. Let's say they start saying they don't, because as the kidney get worse, the toxins build up, right? When toxins build up, some people can start having nausea that just don't go away. They have bad taste in their mouth. Some say they have metallic taste in their mouth. Some say every food tastes like cardboard. You know, by the time people start having that, definitely they need to start dialysis. There's no ifs, ands, or buts about that.
Wow.
However, if they don't have that and it's just the potassium that's going high, the acid level going high, and then we can kind of correct that with medicine until we can't anymore.
Dr. Charles, I am so proud of you. Thank you very much. I mean, I am blessed listening to you, giving us a lot of info. And I may say here that I'm also glad that you ate my wife's fried rice. I think it's also sharpening your brains, because I remember this guy. Let me tell you something. This guy, we went to Jacksonville, Florida to visit him. My wife and I went when we were in Pensacola. We went to visit this guy, and he asked my wife to prepare fried rice. Lydia did the fried rice, and this guy took the food and hid. He said he would not allow me to eat some. My own wife cooks. This guy would not allow me to eat the fried rice because he wanted to keep it. This is how much this guy likes fried rice. And of course, my wife cooks good, so that's good. So, Doc, thank you for.
I cook more for you.
But no, we came to visit. I was supposed to eat. How could you make me go buy McDonald's when my wife has just cooked you, fried rice? But I'm glad it's well because you were there in medical school, so it kind of activated your brains to study very well. Let me put it up. Brother Kofi Upon Ejiri is calling or joining us all the way from London, and he says he's enjoying this program. So, yeah, I just want to let you know that you are doing a good job. All right, Doc. I mean, you are blessing us with this knowledge, and please, listeners. This is free knowledge. We have the tendency of believing that anything that is free is not good. Let's debunk that knowledge. No. We are bringing this because we want to educate our listeners. We want to do that free from our heart. I mean, all of us with higher education, the least we can do is to, spread our knowledge so that we all become knowledgeable and do what we can, because as I said earlier on, God is so generous. He gave us a second chance. If your kidney is messed up, you get a second chance of getting a transplant or something. That is good. But I dare say also that prevention is also better than going through the transplant, because there may be some ramification, there may be some problems that could incur that you don't want to go through. So nature and natural things are always better. Of course, there's a second chance. So let's also learn to keep what we have well. Let's make sure we are avoiding the things that we are not supposed to eat or do to put us into that situation. Of course, some will say, oh, don't worry, if I mess it up, I will get somebody to give me a transplant or whatever it is. Doc, let me chip in this question before I forget. I don't want to digress. But then if you talk about kidney transplants and heart transplant, which one is more difficult to get?
I would say heart is more difficult to get. However, if you have kidney transplants, of course, you just mentioned, oh, yeah, if I just mess it up, I'll get a different kidney. Yeah, of course, you get a different kidney. But one thing you need to think about also, too, because you have when you get a kidney transplant, whether you match or don't match, it's a foreign object in your body.
Okay, that's true.
And our body naturally wants to fight anything that did not come with it, right? So because of that, you have to be on immunosuppressive drug for the rest of your life. Because you have to basically suppress your immune system so they would not fight the kidney that you got. And because you're suppressing your immune system, you have a higher risk of having infection that other people would not get. So why would you want to take yourself through like being healthy like you were, just so you can mess up your kidney, so you can get another kidney and then suppress your immune system so you cannot function like you used to function? That just doesn't make any sense.
All right, so I'll come to some question, but let me go this direction. All right, so now a person knows that, okay, their GFR is low, 20 and downwards, they are candidate for kidney transplant and all that stuff. When you finally get a kidney, how long is that going to last with you? I mean, with the one you mentioned earlier on, that all we need is one, so one should be able to take us. But if you have a transplanted kidney or you're on dialysis, how long can you expand your lifespan? Is there any limit that, okay, this transplanted kidney is going to take me for 5, 10, 20 years, or in cases it takes you to life?
So everything is about average, right?
Average.
So if you're on dialysis, the average lifespan of someone on dialysis is 5 years. However,
5 years? That's scary.
It is scary. However, people have been on dialysis for about 3 months and they died. 1 year they died. And also people have been on dialysis for 20 years and they're still on dialysis. So the thing is, it's not just what you get, it's what you make of what you get.
That's deep.
If someone is on dialysis and they don't follow their nephrologist recommendation, they go whenever they want to go, they don't follow the fluid restriction, they don't follow the food restriction, of course, their lifespan is a little bit shorter than someone who actually follows everything. However, we all know that God will take you when your time comes, regardless.
Okay.
Right? And then for the kidney transplant, the same thing. When someone gets kidney transplanted, first of all, if you have a choice as to what to do, dialysis or kidney transplant is always the best. All right? Okay. So if someone have a kidney transplant, they can live their life just like they used to live their life, except for taking that medicine. Right? Some people can get a kidney transplant and for some reason, bad things happen. Something happened, they don't, a year later, 2 years later, they lose it. However, majority of people that get kidney transplant, will last about 5, 10, 20 years even. I've seen someone who actually got to kidney transplant who was 40 years and counting and still had a kidney transplant. So yes, someone can get a kidney transplant and die with that transplanted kidney.
Well, listeners, let me re-emphasize from what Dr. IBIE said. Second chances are good. You may get a transplant, but then it might not last as you think. So that is why prevention, living the lifestyle that will promote your health is the best policy. That is why Era One, we spend time to educate our people. We are all doing communal service. We want to help with our knowledge, whatever although we pay student loans to get the knowledge, we still want to share it free for those of you who are listening. So please, wherever you are, this is good information. Good information. And Dr. Charles, before I go on, I want you to make a promise on this studio. The whole world is listening. When are you coming back? Because we have to hear more from you. When are you coming back? I know you are busy. We'll talk offline. I want to put you on the spot so at least the whole world. So, yeah, when they ask me, Charles, where is your other Charles who came on your show? When is he coming back? So I can refer and say, Charles, you're asking about you. So you have to come back and re-educate us. All right, now let's get to the hot button. Heart problems, heart disease, heart attack used to be one of the number one problems, medical problem we have. But now COVID-19 has actually come to as if they were running a 100-meter race and, Thompson beat Price or whatever it is. So now COVID is on the rise. I mean, it's taking away lives. How do you, and I read of this that said COVID-19 patients can become kidney patients. COVID-19 patients can become kidney patients. So does kidney infection either intensify somebody with a kidney problem or vice versa?
So does COVID infection intensify, you mean?
Yeah,
right?
if you're infected, yeah.
Yeah, so COVID infection by itself, the way it's been working, the way of course, no one really know everything about this so far yet. From what we know so far, COVID does cause acute kidney injury that can lead you to majority of people end up on dialysis. However, some of them as they're recovering from the COVID, their kidney function get better to the point they can even get off dialysis. Unfortunately, COVID, for the people that gets very serious to the ICU stage, most of them don't make it. The ones that do, though, as they're improving, their kidney function improves with it.
Okay.
So it is COVID infection by itself does cause acute kidney injury. And someone who's on dialysis that got COVID infection, the chance of that person dying from the COVID infection is higher than someone who is completely okay. Because again, like we were saying about transplanted kidney, any dialysis patient who's dependent on the machine, their immune system is lower than someone who's completely healthy. So COVID infection can cause the kidney function to get worse in different ways, actually, to the point of dialysis.
Well, there you heard it from the man himself, from Dr. Charles IBIE. I didn't say it. He said it, and he said, Doctor. The funny thing is that my wife just came on the line. I don't know whether you are seeing her voice. He says, "Hello, Dr. Charles." And but hold on. Both of us are Charles, and both of us are doctors. So don't think it's you.
The real one. The real one.
The real one. I'm sure she forgot to add a real one. So both of us are doctors. I have a PhD on the other side, public health, and you are the real doctor. So you are also the real Charles. That is so unfair. All right. So she says, "Hello, Dr. Charles." So I think she's referring to you. So at this time, I'll give it to you. So Lydia is saying, "Hi, hello, Dr. Charles." That refers to you. Oh, all right. That is cool. Well, Dr. Charles mentioned the relationship between COVID and kidney disease. I don't know whether it's a linear or geometric progression or whatever it is. When we studied Boyle's law, the relationship between pressure and volume and all that stuff that we learned ago, I don't think we used it, but maybe you used it more than I did. So thank you very much. Let me, before our time is, we have only 5 minutes, and I'll let you wrap up with your closing remarks. But before we do, let me just inspire our listeners with this, and then we'll continue. Yeah, take a quick break.
I Aden Urufiana. Say to me, man, any of me, man, any about Aden, I was so Aden me ba, Aden cry. Hey, I was any that's so any that's so, any that's so, any that's on Sakra, any that's so, oh, any that's on Sayo. Any that's so, I am in Subi, any that's so, any that's so, any that's so, oh, I do, get to see, any that's so, Eden krona mumbefra Onyenwe mo crown Eden ebedi anaya banom Ana muni padua Eden krona mumbefra Okransina duane Nani padua sintumana Aden mi ba Aden kra Na ya usani da suasa Okransina duane Nani padua sintumana
Well, nice music. Yeah, actually, I played it because it has a lot of assurances and hope that if you are on the verge where you are going through any medical problems, I just want to assure you that there is always a second chance. And without discussion, if you're having any kidney problem, there is assurance for you. The only reason why a kidney transplant might take longer than you expect is because Dr. Charles already mentioned it's because of incompatibility. It's not just like going to Walmart or dollar store and going to buy a balloon and blowing it. No, it goes to a lot of testing, antigen testing, antibody testing. If it's your body's rejecting, like he said, then it's not going to last. Doctors have to make sure the testing, everything is compatible. That is why even a niece or a nephew might not be able to give you a kidney just because they are not compatible. So that is what we're discussing tonight on Era 1. We're talking about prevention. And at this point, let me just put in quickly before I let Dr. Charles give us his closing remarks. Era 1 is a 24/7 broadcast show. We are live 24/7 every minute, right? When I finish this program, there is music, interlude, and all kinds of program going on. And thanks to Dr. Osetutu for making this possible. On Mondays and Wednesdays, we have our brother Kobe who comes to do the Yensom program. He gives us clips from Ghana and other parts of the world. We get abreast of what is happening. Tuesdays and Thursdays, I am here live on the Divine Connection show. Thursdays in the evening, we have a marriage seminar, AJ02 and his people coming to bless us. Fridays, we have the Count Your Blessing. Dr. Osus and his train come to give us testimony. Mr. Siedo Mafo and Dr. Asiam, they come to tell us what God is doing in our lives. Saturdays, we have the Chukuchaka, Dr. Setutu plays birthday, wishes for almost everybody that calls the stadium or people that want to, give a shout. So please call in the studio if you have somebody celebrating a birthday, surprise them and let Dr. Osus play some nice music for them. Sundays, we have gospel music, we have highlight music, we have Sister Emily coming in the afternoon, we have Brother Kobe coming again, and then the Real in Common Kitten, that is the female section of our broadcast who come in led by our first lady, Sister Dorcas, coming to give us the Real in Common Kitten where they discuss marriage issues, and it's so exciting, so you don't want to miss it. So, of course, Era 1 is 24/7. Don't miss it. All right, Dr. Charles, it's been a pleasure having you in the studio tonight. And I know you already promised, and I know you always keep your word. You will come back. So let's have your closing remarks. We talked about kidney disease. We started by kidney disease. We have some epidemiologists, some stats, how many people are affected or infected, and you give us the causes. And of course, treatment, you mentioned snippets here and there. So I wanted to give us your closing remarks on chronic kidney disease.
All right. So chronic kidney disease, like we said, is one thing I would say about it. You have to, on your own, always try to look at your lab, look at the EGFR and see what your number is. And even if your doctor does not refer you, you have to alert them to refer you if needed.
Okay.
That's number one. Number two, If you know that you have chronic kidney disease from those numbers, you have to try to avoid the medicines that could cause you to get worse. Ibuprofen, goody powder, all the anti-inflammatory drugs. You have to avoid them. Number 3, we talk about the red meat. We talk about the low salt diet. One of the things that we don't want to forget too is lifestyle. Lifestyle is always important. Lifestyle can help you wear off a lot of all these diseases or conditions that we have. Diabetes, high blood pressure, and many other things. All right. So if you do have those though, that's not the end of the world. It can still be controlled. You can control your diabetes. You can still continue to do exercise. One thing I always say, if you're thinking about doing exercise, you do not go from 0 to 100. That's just too much. You have to slowly do things as you can tolerate and make it a lifestyle, not something you do this week and next week you say, I don't know about that. And a month later, you go back to it. So trying to do all these things, hopefully, can try to help you get to chronic kidney disease stage or even get close to dialysis at all. However, if you do have it, some people have it by family issue comes to genetics come into all this too. If that was the case, you can actually know you have it and try to prevent it from getting worse over time.
Awesome. Thank you very much. My wife came back and clarified. She said she was referring to the rare child. So, it wasn't me. I know. I was just kidding. She was referring to me. But I'll go and handle her when we leave the station. Since our days in Florida, I've always said that you owed me the fried rice that my wife prepared for you. But now that you came on the studio and helped us, educated us on kidney. We are now, you don't owe me fried rice anymore.
Okay.
you paid your
back and get some more fried rice.
You paid your dues. Thank you very much. I want to say thanks to all the folks that joined us. Our brother Kofi from UK, Lydia BOISON, Brother Roberts also joined us, but he has to leave for somewhere. So thank you very much for joining us tonight. It's been a pleasure having my old schoolmate buddy, old Navy guy and everything. We go way back, and we are still friends because, we talk every now and then. So I remember last time I went to Alabama and I think I went to his wife and did your wife try to cook me fried rice? I think so.
Did cook you fried rice.
She did, huh? So now we are even more even. Okay, I got you. That was nice. Thanks for the reception. Anytime I come to Alabama, I'm going to pass by. So thank you for spending your hour with us because I know you are always on call. We'll be calling you for dialysis issues. So thank you. And you already made a promise, and I'm going to put it in my journal that you promised coming back to the studio. So I'll call you and we'll discuss when I'm going to have you back because you have to educate us. We need knowledge. Knowledge is power and it's going to bless us. So thank you for not being stingy with your knowledge. You are sharing it. You're doing your communal work, and Ghana and Nigeria will go way back. I know when we came to your country, you guys kicked us out, and so we developed a bag called Ghana Must Go. I think I still have a copy of that bag, Ghana Must Go. But it's okay. We are still brothers. So thank you very much for being on Era One. We all appreciate you, and I'll talk to you offline. You coming back because we have more to discuss. So thank you, and to all our listeners, have a good evening. You can go back to Era One Facebook or YouTube and just play the clip again. Educate yourself because you might not have this knowledge everywhere. And as I said earlier, anybody can go to Google on internet and Google information, but you can't get it as much as having a real live doctor in the studio explaining things the way they are. So Doc, thank you very much. As we do, I salute. So I'll talk to you later. Have a good evening. Bye-bye.
Talk to you, man. Take care.
All righty.
Bye, Lydia. All right.
Okay, I'll let you know. Okay, bye.
I Atavara didi we
Mino di wachinti Oriari wane nyarewo
Isimeni arewo
Adena wasuwa manisuwa kosunyede
Aden urefiana
Se otumi manya eni
Otumi manya